Hi, my name's Stephen Newton. I am the administrative director for Redstone Husky Rescue, and I'm a student, and I'm located out of Commerce, Texas, in the United States.
Hello, I'm Francisca Malfe. I'm a clinical geneticist and I'm located in Ghent in Belgium. And I would like to welcome you, Stephen, and thank you for agreeing to do this interview here today with us. So let me first start by asking you whether you could tell me a little bit about the condition that you have.
So I have classical-like Ehlers-Danlos syndrome. Mostly involves like mildly hyperextensible skin, hypermobile joints, easy bruising, pull wound healing. One of my more particular ones that I always point out is it can cause nerve issues, so like carpal tunnel syndrome and such. It's how I describe it is like having all the best parts of classical Ehlers-Danlos and hypermobile Ehlers-Danlos all at the same time.
Okay, so and I'm guessing that your diagnosis was confirmed by genetic test. Is that correct?
We have spent so much time on the rule outs. We spent so much time on the criteria. And the physical therapist I was talking about, she actually works a lot with EDS Society, and she is a big advocate. She's actually the leading expert in that area that I was living in Colorado, and runs a bunch of pain groups. And she spent a lot of time because I was going to be her first patient ever with classical like EDS. And so she wanted
Can
to make
imagine.
sure that she
Yeah.
got it right.
Yes.
But all the geneticists in the area, they were like, yeah, I can maybe get you in 3 years. There's like, I was like,
Amazing. It's amazing.
okay.
Yeah.
So I'm going to be trying more here in the Dallas area to actually get that confirmation. But when
Yeah.
it comes down to it, at least in my mind, my primary care's mind, my physical therapist's mind, my cardiologist's mind, who is very experienced in POTS dysautonomia EDS, we are all kind of on the same page. So
Yeah.
it is terrible, like the level of access that there is, and just how much of a struggle it is even to get to the right doctors. Like I've seen over 25, 30 physicians before I finally got a diagnosis.
Yeah.
I was getting lab tests, all just every lab test in imagination, and yet doctors had seen my skin, they had seen my hypermobility, they had seen all of my joint and tendon issues and all of that, and they just never went for this. They're
Yeah.
just like, oh, it has to be something simple.
Yeah.
Let's just throw some GI tests at
Yeah.
you, and or oh, your pain's not that bad. I went to a rheumatologist that so many people had recommended, even zebras, and having such a rare subtype of EDS,
Yeah.
I was actually dismissed right there that I don't have it.
Yeah.
She looked at a couple factors and she was just like, oh, I don't think you have it. And I fully believe fibromyalgia is a real disorder, and
Mm.
but she just went, I think you have fibromyalgia, and that's it.
Yeah.
And so after having all these people confirm my diagnosis, and then all of a sudden I went to this rheumatologist that they're like, yeah, this will be great, and we can actually get some treatment done. She dismissed it. She said it was fibromyalgia and actually sent me out there without any treatment, without any medication, no referrals, nothing. She's just like, just try to figure out the pain through your physical therapy and deal with it.
Yeah.
And it was one of the most discouraging experiences I had had. And I actually haven't been to a rheumatologist since, even though I know I need to for a few things, just because of that experience was so negative.
Yes.
And it is the reality that so many zebras are facing is, and especially, and not to minimize at all the experiences that more the quote unquote common types are going through, but the very rare types having those specific categories that don't necessarily look like EDS, but they
Mhm.
maybe internally look
Mhm.
exactly like EDS. And so you just get dismissed.
Yeah.
And even if you've had that diagnosis, it can just be, it just is so defeating. You're
Yeah.
just like, I can't, how do I function through this? So it's
Yeah.
just yet another person telling you that you're not
Yeah. Yeah.
there. But, it's to say that and then also say that There are a ton of people out there though that are learning. They're
Exactly.
getting better
Yeah.
at it. I
Yeah.
just had this carpal tunnel surgery. My anesthesiologist knew what EDS was right off the bat, knew exactly what to do about it, and knew how to handle it for my surgery. And it was probably the best anesthesia experience I have had. And I was so ecstatic. Like, and she was even excited to see somebody with EDS. She's like, "Oh, I get to apply this knowledge." So it's like
Yeah.
there are providers out there that are learning, and
Yeah.
I'm just glad that the advocacy is getting out there.
And did you ever get any explanation about the genetics of Ehlers-Danlos syndrome or of the classical-like subtype?
So, yes, I did get actually a pretty decent explanation. My primary care physician was surprisingly knowledgeable on the subject. I ended up finding the right one. And it kind of breaks into how it is a complete TNX deficiency. It somewhat mimics the look of classical EDS but it is actually missing a specific gene marker, and that it is required for both the parents to have a copy of the gene, so autosomal recessive inheritance. So in this case, actually, both my parents do show signs of Ehlers-Danlos and the right signs. So it ends up that I ended up with that recessive gene, and just very special circumstances to line up.
Yeah, exactly. And could you tell me a little bit about how the condition affects your life on a day-to-day basis?
So it's about 4 words. Every day is pain. That is the easiest way to describe it. My every movement involves popping, cracking, luxating joints. My skin loves to tear. It basically anything mildly sharp touches my skin and it just slices right through. Right now, I'm actually wearing a posture shirt as well, because I have the luxating joints. It's especially my shoulders, it can cause severe pain. Sleep is an extreme struggle. I've woken up before in tears and screaming in pain because I had a joint decide to luxate at that moment, especially my shoulders on the side sleeper. Um, but what I really say when it comes down to is the worst for me is any repetitive tasks. Like I mentioned, how it can cause nerve issues, and it can cause tendon issues. So I've had to have carpal tunnel surgery, trigger finger surgery, lateral epicondyle surgery. I've got patellas that like to luxate. It's basically everything. It just moves and it's just ready to tear if it just hyperextends at the right point.
Yeah, yeah, yeah. You know, you've been through a lot of pain and suffering, etc. But do you think the condition or knowing about what you have now, has it brought you any good things in life?
The biggest things that I would say it's brought me definitely is compassion and understanding. My career is moving towards getting my LPC, my licensed professional counselor licensure. And I intend to work as a therapist for those with chronic illness. Having that background of what I've been through is going to give me a lot more understanding for what other people are going through, and to be able to step in when somebody is struggling and say, I can help you, and let me just talk to me about it and I'll understand. It is something that you really can't put a value on.
Yeah.
And just one other amazing thing that's brought me is just a family. The Zebra family is just amazing. And I am one of the admins for the largest CDS groups on Facebook. And
Oh, nice.
the family and community there is just amazing. Like there is something to be said for that we all come together and we help each other. And I really wouldn't give that up for anything.
Yeah, great. That's actually great to hear that you also have positive things that come out of it, and that it has brought you also joy, I would say then. And a way forward. So, well, thank you very much, Stephen. I wish you all the best of luck with your studies and with your dogs.
I
And
really appreciate you having me and letting me talk about this. And, it's such a rare condition. It's good to have some voices out there.
exactly. Yeah, I totally agree. So thank you very much.
Thank you.